Next up, we have Dr. Matt Rayner. He's going to be talking about
how we feed our bodies. So, everybody here in healthcare, some way, shape, or form? Okay, one outlier, that's good. But how many people get frustrated with, you want everybody to see their results, get better as fast as they can, get as strong as fast as they can. A lot of what our office does is when that doesn't happen, we start trying to figure out the cell piece, what's going on. And I think that's where, when you look at whether it's the aging process, the injury process, is somebody getting repetitively injured, is there a mechanism that's kind of beyond what your skill set's bringing them? Like, you're doing the right thing, and that's why I want to kind of go on this topic, because this pretty much most of what I do every day is looking at why is somebody feeling crummy. Why are they chronically fatigued? They're on thyroid hormone, they're still depressed, like they're still having all these issues. So my office is an integrative clinic. We have nutrition, dietitians, 2 medical providers. I do a lot of the functional medicine. My business partner does a lot of the functional neurology. We started off really going after the brain, but you started seeing all these other problems kind of tied into it. And so, again, sorry if this brings back any bad memories from biology, but that's not the point. So we're 38 trillion cells. This, you want me to talk loud? Yeah, I can do that. I was worried I'd be yelling. I don't think it is. That's fine. So there's 38 trillion cells in our body, right? And so when you actually divide up, she was just up here talking about bone cells, muscle cells, and different tissues. When you picture that, though, each cell has the energy of a AA battery. So we're 38 trillion AA batteries walking around. Every single day, we lose 70 to 80 billion cells and we remodel and rebuild them. And so kind of going to like the problem is, and I think the industry you're in, we see people come in with skeletal problems, recovery problems. And when you look at the trend of what's going on from a healthcare standpoint, we're kind of there to kind of be leaders in this and picking up. If you look at dementia rates are going up, diabetic rates are going up, these all do what to the cell, right? 1/3 of our population's either diabetic or pre-diabetic. Again, it messes with this, which messes with your ability to recover and rebuild those cells. And so that's where I thought this would be kind of, how can we be better at making sure the people we work with are fueled up and not on that side? Because this is where we're going to get frustrated. This is where they're not going to feel well. This is going to be the client or the patient that I work out, I'm sore for 4 or 5 days. Has anybody ever had that? They feel hungover, they're fatigued. What's going on? And that's kind of what we do. It's like, what testing should we do? What should we look at? And what can we be thinking? Because at some level in the cell and the mitochondria, this is breaking down, and it's not just work out harder, recover, drink more water. There are things that are deeper that we need to figure out that might stave off dementia or cardiovascular disease if you start figuring these things out, because ultimately those things are still mitochondrial diseases. So again, try not to bore you with the basics, but we can do our macros, and a lot of times, again, we talk to our clients about the macronutrients, the micronutrients. That stuff's pretty boring to me, but it's important, right? But the goal is to get the ATP, and that's never stored, but it's roughly a AA battery in terms of energy capacity. Our mitochondria are 30% of our cell volumes, and again, this is why this is important, because that patient with the muscle problem that's chronic might be the first sign, because skeletal muscle is one of the highest densities of mitochondria. The brain, liver, kidney, endocrine tissue. So a lot of times as providers, we might see that might be the first sign of a patient that might be cardiovascular down the way. And so if we can help them have actually a good response to our training, we won't get frustrated, but we may also curve other issues coming. So is the process in our body of making energy perfect? Do we do it cleanly? Right? Do we need oxygen? Right? So if we don't have oxygen, we go into our lactic acid cycle, we feel miserable, correct? And so even if we are really efficient about it, we still make hydrogen peroxide, superoxide, and hydroxyl anions as a normal energy process, right? So when you have that patient, that client, like I was sore for 5 days, or I felt hungover, this is kind of what I want you to start thinking about, is like the waste. Like you push them, they created waste. Could they handle the cleanup, right? Even in a perfect scenario, we make a 5% yield of hydrogen peroxide. That's good. A diabetic, it's 200% higher. And so you picture the metabolic issue. Are these people who are diabetic or love to eat sweets, crushing sugar, are they gonna wipe these kind of antioxidant systems out faster? And again, if they show up, how can we catch that? How can we start looking like, is this something that, you know, I can do them a great service by targeting that? So really basic. Who here has been told they're anemic and said it was normal because you're a female? Has anybody heard that? Yeah. It's one of the most frustrating things, right? Because I mean, I can do a 3-day conversation about just what anemia's impact, but at the very basic level, what's that cell need to do its job, right? To keep you from aging faster, you need oxygen, right? And again, so if you're anemic, that's a very basic hit. Blood sugar, right? So whether you're hypothyroid, right? The thyroid receptors, growth hormone receptors, they're all modulating how much activity drives cell activity inside. And so a lot of times we try to label it one thing, or they're inflamed, but it still comes down to this guy. And so what we do is try to get in and figure out what's needed, what's missing, what's impacted, and how do we start to break that down. So blood sugar, hormone modulation, those are all basic things. Here's all just the nutrients on the far right side that have to come into play, but you also have to have that cleanup department, right? So your glutathione, your superoxide dismutase, your catalase system, there's genetics that play into that. Some people have SNPs that they don't produce it as fast. Here are things that are damaging, and this is the other aspect. Like, why are people seeing more chronic disease? It's growing at 1% to 2% every year. So, like I said, we make waste, a 5% yield of hydrogen peroxide, superoxide anions, just from doing business to making energy for the cell. That waste, if it's not cleaned up, is going to age mitochondrial DNA and other DNA in the cell, slowly allows the aging process to occur. So the better we are at that, the longer and healthier we're going to live. There's genetic susceptibility, that's a whole other talk. Heavy metals will block the mitochondria very, very quickly. Pesticides, so glyphosate blocks electron transport chain 3, a very specific step in the mitochondria. Again, how many people are eating organic? How many aren't? And even if it is organic, is it actually pesticide free? There's questions. Does your client that you're working with, are they drinking 5 nights a week and they're coming and blaming you for like, hey, I'm not getting stronger? Is there, is that part of the story? Because I think a lot of times when we can direct the conversation with the client and be like, hey, look, this is our history I went through with you, and these are all the vulnerabilities on your report card. What can we address to clean that up so you have the best result with us? Talked about alcohol, prescription drugs. Anybody know any prescription drugs that are really bad on the cell? Nobody wants? A lot of them, right? But again, when you go through this list, you're like, holy crap, like how many patients these are all some of the most common ones. One of the ones that, from a chiropractic side, statins. Statins are hard to see patients get better from a muscle standpoint. I had an older man, he came in a total cholesterol of 100, right? I mean, there's studies that show cancer risk go up with that. And again, if the cell can't take care of mutations and cause programmed cell death, cancer risk goes up. So that's another aspect. But you work in on his hip flexors, he's like, oh, I feel great, that sharp pain's gone. And you're like, we'll see you tomorrow or see you in a week from now. He's like, as soon as I sat down and went to bed, boom, it happened again. Then you start digging deeper and you're like, have you had any blood work? Sure enough, his cholesterol is 100. And his muscle quality felt just stringy, like it didn't respond well to anything. Also, he's like, yeah, I was sore for 4 or 5 days. Like, okay, that was kind of the first flag. I'm like, I need to start seeing some blood work. Turns out he was diabetic, put him on a statin. And again, the problem with that is, again, the cardiovascular disease is probably being driven by the mitochondrial problem, and now it's just going to be kind of pushed to the middle. Antibiotics, antidepressants, antipsychotics. So you start thinking like fibromyalgia, chronic pain patients, they're on a lot of these medications. And again, are they gonna have a good response? And if they don't, are there things that we kind of start to look at? Like, are there things we can do to look at this and start making recommendations to help these people out where we're getting stuck? Tylenol, aspirin. Again, chiropractors, PTs, trainers, a lot of the people we see are taking these a lot, but they slow down the cell. History and intake, I'm not sure what your history or kind of first initial visits look like, but I always ask them, like, how do you sleep? How do you, if you exercise, how do you recover? Does it take 2 to 3 days, or is it, 4 or 5 days? Do you feel hungover? Do you get the endorphin rush? Do you feel depressed? Those are some basic metrics. Go through oxygen. Do you have sleep apnea? Does your wife, your partner tell you snore? Again, just going through the basics. Are their hands discolored? Do they have cold hands, cold feet, brain fog? Those are some. Going through thyroid health, metabolic health, any blood sugar issues. If you don't eat for a while, how do you feel? Oh, I get hangry, I crash. Like, okay, some type of blood sugar problem going on that we probably need to at least account for and start having them eat every 2 to 3 hours, good protein and good fat. Response to care. When I work on them, how do they respond? Assessments, things that I think are really valuable to have when you work on people. Pulse ox. Do you guys ever use those with people? Having a pulse ox, if you're doing rehab with them and you start just seeing their like oxygen saturation crash, again, usually that's a good indicator, like their ability to deliver fuel is being compromised. Laser therapy, do you guys do laser? If you give somebody laser therapy, again, a lot of times laser therapy works great. It stimulates the cell, increases ATP production, allows the cell to recover. But you do it on somebody, you're like, man, I was for sure this was the type of injury that was going to respond. If it doesn't respond, again, it kind of ties it back into it. Is there something going on that's deeper in the cell that we need to look at? Here's just a bunch of mitochondrial diseases: rhabdo, muscle weakness, exercise intolerance, heart failure, cardiomyopathy, migraines, headaches. Boring stuff, but we see a lot of it, that's why. So I know I was worried about time, so I just kind of flew through it. What questions do people have?
Well, I have a client.
So, okay. Okay. So lab testing. So lab testing shouldn't be 2 to 3 pages on people, right? You should look at beyond the CBC for anemias, right? A lot of times to be diagnosed with anemia, they look at, basically the red blood cells, are they low in number? But again, that's not enough to tell if somebody's anemic. You need to look at iron, ferritin, TIBC, transferritin, other metrics about the red blood cell. Because let's say iron's normal, the size of the red blood cell is normal, but yet you're still low in iron. Is it anemia? Yeah, they didn't look hard. They just did the standard labs. Insulin, the fasting insulin, fasting cortisol, hemoglobin A1C. You can look at C-peptide. That's the kind of the dimer that holds insulin together. That's blood sugar. That's a start. Homocysteine is a very good idea too. As we start to see DNA damage, we start to not methylate, and so you'll start to see homocysteine climb up. It's a $10 lab marker. If it's above 7, it's associated with cortical atrophy, so your brain shrinks the higher it goes. Above 14, it's a cardiovascular marker. Osteoporosis, it inhibits osteoblasts or baby bone cells from generating and increases breakdown of bone. So there's a lot of metrics with just that marker. Organic acids are really good. CRP, those are all labs that should be in there just to tell us, like, if you're having tissue damage, CK levels would be good. Organic acids.
So what would be some common systemic issues that we might see in here that would be good to refer out to you potentially to get testing for?
It's anybody that you're feeling like you give them something that works 90% of the time on somebody, and they're responding poorly. They're getting a headache after an working out, or they're feeling blah, depressed, or just like is more of a systemic response to what you did with them. That'd probably be it. Like they're responding systemically when you just did the squats with them. That doesn't make sense. Yep.
problem. So, and out of 10 people that maybe I would tell to go see, maybe like 1 or 2 would actually go. So if we, like, do you have like 3 takeaways that we could, like,
So
tangible things
I
that
would
would
go,
be useful?
I would go through and have the conversations like, hey, look for the risk factors. I mean, kind of create a scorecard. If they're not getting better, or hey, you know, here's where I think I'm going to have issues with this patient or client. If they go home and they just eat like trash, right? There's one. And I always just tell the person, like, hey, this is how you get the best results. Boom. If you do these things and they're not getting better, then you've already kind of prefaced, like, this is how you get results. If it's not going to happen or it doesn't happen, then I think it's good to look deeper. And then that's the one kind of turnaround. But that's where you can start looking at how they respond when they fast. Are they waking up in the middle of the night, mind racing? Again, another blood sugar symptom. Blood work. But I would just, so takeaways, pulse ox, put them on there. If they're crashing, their pulse ox is, you know, oxygen saturation is getting below 95%. They're having issues pushing fuel out. If you're seeing like, or any tachycardia, stuff like that, those are signs. Again, there's just a lot of tools you can easily implement for cheap. If they work out longer, the longer, you know, and a lot of times what I would start with them is, hey, you know what, we're going to change it up. We're going to go, instead of going for an hour session, we're going to do 15 minutes. If you feel good and you have a better benefit, then there's something metabolic going on, and we're going to add 1 minute to 2 per workout until we kind of hit a good threshold for you. That's what we do from a lot of our chronic patients. Like, start at 7 to 8 minutes. Our first goal is you feel good, you don't feel crummy the next day, you don't feel crummy the day after that, and we start kind of